Good afternoon, friends and ladies and gentlemen. And thank you, Dr. Satanshu, for giving me this opportunity to be here with all of you. The topic which I am going to talk about is terminal chop, an easy technique to crack and break the difficult hard cataract. Friends, we know that these hard cataracts have always been a challenge to all of us. And the challenge is primarily because of the following reasons. Because these hard cataracts have very weak and fragile capsular bag. They have an absence of protective epinuclear layer. There is a paucity of cortex. The capsulonuclear adhesion is another problem because since there is no cortex, no epinucleus, so the nucleus may adhere to the capsule. So you may have adhesion with the capsule. There is a laxity of the zonules. There is a compromised cornea. And many a times non-dilating pupil or the pupil coming down during the surgery. So creation of rhexis is one of the very important points because in these hard cataract, your rhexis has to be correct. It should be complete. It should be of sufficient size so that the manipulation of the nucleus becomes very easy. If you don't have the large rhexis, then it becomes very difficult to manipulate the nucleus. Your hydro procedure should be complete. And if at all, if the hydrodissection is not possible, then just leave it and you can rotate the nucleus later on. Because pushing a lot of fluid with the adhesions there, it may rupture the posterior capsule. You must use soft shell technique. Your visco injection should be much better, and the soft shell technique you all know. And your phaco settings have to be correct and appropriate for the cases. Looking after these challenges, but what I think is the most important challenge in these hard cataract is breaking them down into full thickness free segments. So this is the most important challenge. Unless you break the nucleus into full thickness free segments, the surgery would become prolonged manipulation, a lot of manipulation. You'll have to use a lot of phaco forces, a lot of phaco manipulation. So that could be very deleterious to the adjacent structure, especially cornea and the posterior capsule and the iris also. And it's very important to break them. The current surgical techniques, whether you use the original techniques or you use the hybrid techniques, what happens, we get into using multi-stroke drilling, trenching, grooving, creating. So all these things would lead to a lot of use of phaco forces in the anterior chamber, very close to the corneal endothelium. And the manipulation which we do is very close to the posterior capsule. If you are handling the nucleus at the center, that is the hardest part of the nucleus, and then you have to drill it, like you have to do the trenching of this kind, like which would need a lot of phaco forces. And using too much of phaco forces, you know, the status of the cornea may get disturbed. And going very deep, very close to the posterior capsule, you may hit the posterior capsule and land up with the problem of the PCR and all. So and then forcibly splitting the nucleus without having crack. If you split, because you do the trench and then you try to split. And this splitting force actually like this, like if you are splitting without having any drill or without having anything in this and you try to split these nuclei, increases the risk of injury to the supportive structure of the lens. And then we'll end up with these complications. So if you have to deal with the hard cataract, your technique has to be very easy. It should be safe. It should be simple, swift, effective, with minimal manipulation and least traumatic. And the most important is it should be consistent. It should work on each and every case. So I'm going to talk about which is called as a single stroke crack and break hard cataract with terminal chop technique. And the device which we use for this technique is called as a terminator. So these are our publication in various journals, and recently this technique has been included in ASCR's teaching program, and which is like one of the very important point, for this technique to be included there. So what is terminal chop technique? Terminal chop technique is a crack and split. So this is the point. You crack the nucleus first and then split. In other techniques, what we have been doing, we split to crack. So there is a lot of difference. Here, you crack it first and then split. You can see here, what I'm trying to do is, I'm just holding the nucleus at the equator, just within the equator, draw it a bit, hook the terminator and crack, and then split. So with this method, you can crack the nucleus into two complete pieces. So that is the most important thing. And the depth of the crack is full thickness. So you get a full thickness cracking of the nucleus. You can see here the second crack of the heavy nucleus. You can crack the nucleus accordingly. The hardness of the nucleus, you can crack into 4 pieces, 2 pieces, or 6 pieces. See here, draw it, hook it, and crack it. And you can see the cracking is full thickness. You can see the glow behind. So this is the beauty of the technique. Like you get a full thickness crack, and if you get full thickness crack, then you can very simply draw them on the phaco probe with the phaco probe and emulsify with the proper settings of the emulsification, because you don't need too much of high phaco forces, high energy also. The important point, as I have told in the beginning itself, is correct and proper size of the rhexis. So this is very important. You must get at least 5.5 to 6 millimeter of rhexis. In any case, any hard cataract, if you are dealing with a hard cataract, your rhexis should be larger, a little larger. It should not be small. So then your handling of the nucleus becomes very, very easy. Now this is the second case you can see here, a calcified nucleus. You just hold it at the equator, impale from the center, hook it, and crack it. See the cracking, the kind of cracking you get. So this is what you want in these hard cataract. So for that, what you have to do is the vacuum settings should be around 350 to 450. Flow should be around 25 to 35. Phaco power, not too high, around 40% is enough. Your bottle height should be around 120 to 140 centimeter. And the tip, you can use any tip, but it should be either 0 degree or 15 degree, because you don't need too much of bevel to hold the nucleus. And you can see here the holding. The moment you enter this device into the nucleus, it cracks the nucleus. So you have a complete crack in the beginning itself, and then you split the nucleus into 2 complete pieces. So this is how you can split. And the splitting becomes very easy, and it's full thickness splitting. So the question comes, how do these nuclei crack with this device? The unique physical property of these brittle hard objects has been described by Griffiths long back, somewhere in 1920, one of the physicists, very great physicist. And what he said was, like any solid hard material, they are stronger in compression, but they are weaker in their tensile strength. So what does this mean? This means if you want to crush, cut, chop, sculpt, or break without having a crack these hard object, it will need lot of forces, lot of energy. But at the same time, these hard objects, they crack very easily without too much of forces. So this is the basic of this technique. This has been published long back. This is how it cracks. You don't have to do too much of forces for cracking these hard objects. So for this, we devised an instrument which is called as a terminator, which is actually designed, created, and applied with the principle of classical simple machine. So you all know classical simple machines. The 6 classical simple machines which we have been taught during our primary education. And one of these simple machine is called the wedge. So you can see here, this is the wedge. And these wedges are used to separate 2 objects or induce crack or fracture an object into 2. They are commonly used. So a lot of wedges being used in the factories and other purposes. So why it is very important? See the wedges, what the wedges does. Wedges changes the force of direction. A radial force, like if you're putting a radial force is converted into a transversal force. So this transversal force works for cracking the nucleus. So that is why the wedges are used for separating and cracking these hard objects. And secondly, it increases the amplification of the force. Like it improves the amplification. You put a little force and it is amplified by that instrument, wedge. So that is why wedges have been used in many purposes. So what we did, we actually incorporated this wedge design into the tip of our chopper. So you can see how we did. So this is the wedge which we incorporated here. So what we did was the tip of the wedge, that is the apex of the wedge, is the inner edge of the chopper, and the base of the wedge is the posterior surface of the chopper. And this chopper actually, so I don't call it as a chopper, I call it as a cracker basically. So you can see this is how it comes out. So it has a apex inner side and the base posterior surface which is flatter. So when this device enters into a hard object, it gives you a cracking effect, a cracking force. So this is how this looks like. And we created a different angles of the wedge. There are different angles of the wedge, but the 75-degree angle of wedge works best for the hard cataract. So we devised 100-degree angle also, which works for the soft cataract. The conventional chopper which we have been using till now, they don't have wedge effect. They have hardly less than 20 degree of wedge. So if you have a wedge of less than 20 degree, this will not produce any transversal fracture force. They will not produce. You have to just drag them. You have to drag these conventional chopper through the hard nucleus. It doesn't give you a cracking force. You have to cut it. And you know, cutting hard nucleus is very difficult. You can't cut it. So that is why we get the problem in using these conventional chopper and getting the fracture of the nucleus. And this is the overall design. Just 1 minute, that's it. This is the final design. It has an olive tip. It's a blunt tip. So if you're hooking the nucleus, there is no threat to the posterior capsule. So you can just hook very safely. And rest of the features that you have already seen. And how it works, you can see here in this video animation. The nucleus is held with the phaco probe, drawn a bit, and then you hook it very safely. And the moment you draw this device into the nucleus cracks. So this is how you get the cracking effect. And then once you have a crack, and then you can split the nucleus very safely. So I'll just show you the last video. So this is one of the very, very hard cataract, which is more than grade 6 cataract, like black cataract. Does this instrument work in this situation also? Like you can see here, very simply, you can crack even these rock hard cataract also. So what you have to do is impale the nucleus a little distal from the center. Your phaco probe has to be superficial. Don't go deep. Superficial, then only you'll reach the equator, and then hold the nucleus just within the equator, a millimeter or two within the equator of the nucleus, not the cataract, nucleus. Then you draw the nucleus, hook it, and crack it. And then you get a complete full thickness cracking of this. See, you can crack even these hardest of hard cataract with this device. See the another crack? Once you created the heminuclei, then you hold one of the heminuclei and crack it further into 2, 4 pieces. This is the another crack. I'm going from the other side. Hold the nucleus superficially. So this is important point. Hold it, break it. Now you have a complete full thickness pieces. Go for the another crack of the, to make it another piece, 4 pieces. You have to be very slow in these hard cataract because you have a very weak capsule. So go for the another crack, hold it, impale it towards the equator, hold the nucleus just within the equator, draw it, hook it, and crack it. So now you have a full thickness pieces. And these pieces, now you can draw them on the phaco probe very simply. The important point here is like you are not putting too much of stress. So your zonules are always safe. There is no stress on the zonules. You are not working very close to the posterior capsule, so there is no threat to the posterior capsule. You are not using too much of phaco forces, so your cornea is absolutely safe. And if you do with this technique, you get a crystal clear cornea on the second day itself, and you don't have to bother for the complications and all with this technique. It's very, very safe, very simple technique, and it's repeatable, it's reproducible, it works in each category of cataract. You can use for the grade 1, grade 2, grade 3, 4 cataract also, and it works best for the hardest of hard, the grade 6 cataract also. Thank you very much.